Warahmatullah. Now, communication scenario. This is a paracetamol poisoning. So, this station can come in two ways. Suppose a medical student or nursing student wants to know about the management, and it can be um, came as a teenager scenario that this teenage has taken a paracetamol overdose and now she is refusing the treatment. The two scenarios are the differently we have to handle. First, just I'm discussing how can we do the scenario with nursing student or medical student. So just like other videos I have shared how to do the communication scenario with medical student. So, hello, good morning. Me, Dr. Roxana, and I think you know me because previously we met several times in our meeting, morning meeting, isn't it? Are you, I think, Dr. Arif, isn't it? Okay, how things are going? Yes, so Arif, I came to know that you have concern regarding one patient which called Helen, 14 years old girl. Yes, then Mr. Dr. Arif will tell, yes, I'm very much concerned regarding the management of paracetamol poisoning. Okay, so how far you know about paracetamol? Do you want anyone of your colleague to attend this session? Because I think sharing is caring. For this reason, we can get a lots of information at a time. He may tell that no, everyone is busy, so it's okay. So first of all, judging the prior knowledge, how far you know about paracetamol poisoning. So he will state some points. In yes, absolutely, you are right. So which point in this management is bothering you? So first question may be why we have to wait for the checking of the label 4 hours, then we will start an still system. So what's your idea that what why we doing this at the doing this level at 4 hours after ingestion? um, just we are asking, and then he may answer, or otherwise the answer is that after ingestion of the paracetamol to reach in the blood the peak level it times 4 hours. To find the peak level of paracetamol we have to wait 4 hours, and if the level then we have to put the level on the chart, paracetamol poisoning chart. Do you know about this chart? How far you know about this chart? Though, so you can follow me with this diagram, and this chart there is the time and there is the level of the paracetamol. So at the 4 hour this is the maximum level, and if we found the level is on the line or above the line, so we have to start treatment with an acetylcysteine. Here we will talk very slowly, giving pause, etc. Okay. And then Mr. Dr. Arif may ask you, so how N-acetyl cysteine help? Because paracetamol is a very common drug. Why this is caused so much toxicity? So, do you have any idea how the paracetamol works in the body? So, the thing is that whenever we take paracetamol, 95% conjugate with glucuride sulfate, and this is excreted by urine. But 5% produces NAPQI, and it is very toxic. Normal in therapeutic dose, it will bind with glutathione and become less toxic and excrete in urine. This is how normal therapeutic dose works in the body and excretes from the body. But whenever there is a large dose, so there will be increased level of NAPQI, and there is less amount of glutathione to make it conjugate. If this level is very low, so this NAPQI causing liver toxicity. Are you with me? Okay. So another question may be how N-acetylcysteine works in the body. So, Arif, can you tell? Do you have any idea how it works in our body? So the thing is that it has protective mechanism. It acts as a precursor of glutathione, promoting normal conjugation, and it also supply thiols that function as antioxidant. And then so, what should we do if we found this case of paracetamol poisoning? If it comes less than 1 hour, so we can give that activated charcoal. But if the patient comes after within 1 to 4 hours, so we have to wait, and by this time we can send INR, blood urea electrolytes, and uh, blood arterial blood gas level. And then we will also keeping follow up and making the child stable. We will involve our consultant toxicology department, and when the child will regain the consciousness level, or within 24 hours of admission, psychological we will psychiatric review is needed. Here we have to mention this three line: inform the consultant, toxicology, inform the toxicology department, and also the psychiatric review is very important. And what investigation, Dr. Arif may ask? So investigation is INR, because INR level will help the level of liver toxicity, and blood sugar level is because hypoglycemia is common in hepatic toxicity, and urea and electrolytes, and N-acetylcysteine after 4 hours. And then we will ask if the 6 minutes over, and we found that our role player has a lots of question. Yes, I can found that you have a lots of question, and I must appreciate your effort. So how about, because but our time is limited, so how about it sounds that we can make another meeting to discuss with the more question, that you can gather another question that we both can solve together. How about it sound? And so can you please summarize? I will give you some leaflet trusted website so that you can make a seminar on paracetamol poisoning. How do you feel about it? And thank you for coming. This is how we can do the paracetamol poisoning scenario with our junior doctor or nursing student. But if the scenario is the teenage present with paracetamol poisoning, now refuse the treatment, it's a totally different. So the scenario may be that first of all we are exploring the concern that uh, that Aisha, I came to know that you have taken a lots of paracetamol, which is we found that the level in your blood level is too much. So I'm here to talk about with it. Is it the proper time? Do your mom know that you are here? And how far you know about that? Increase this level of toxicity, level of paracetamol. How can effect on your body? So your our response will depends upon the role player's reaction. So she may depressed. So can you tell me how life is going on? Your life is going. She may till that life is so difficult. There is I have a broken relationship with my cousin. Oh, I can understand. Then oh, it's a communication scenario, but somehow we can address some hate history that we have to take in the history scenario. So how your home environment, can you please share with me? And it's a routine question: do you smoke or taking alcohol? How your school performance? It's a routine question, as a teenager. I think you may understand that. Do you have are you sexually active? Okay. And so Aisha, why you are when it is the first time you take lots of, or it is the previous time you take this? She took this. No, I took it previously. Okay. So, do you have any suicidal thing in your mind? She made him say yes. Okay. So, I want to ask that why you are against to take the treatment of this? She may um, talk lots of things. Yes, Aisha, life is not a bed of roses. That we all know that. In our life, difficult times may come, but we have. But the intelligent and smart teenager are those who can handle this situation in a very effective manner. Yes. So, would you please tell me why are you against the treatment? Because ups and downs comes in the life, and your whole life is waiting for you, just like this smart girl. Okay. So, because I have needle phobia, yes, we can do it very silently, and I can found that as you are come for the treatment, that means you want support from. We are here to support you, and after the treatment, treatment is available and we keep you in a follow up. We're all with you, and after treatment, as you are going through a uh, very difficult condition, so how about you go through a mind doctor that he or she will help you to think or to solve this different condition in a, in another way, in which make you less stressful. In these teenagers, it's very usual to go through this different stage, and sometimes we don't know how to solve it. We will not in the communication scenario, we'll try not to tell lots of things. We will tell 40%, and we have to give the chance the role player to say 60% of communication. And so, do you have any other concern? Can we summarize? I will give you trusted website, and I will can meet to the person who go through this events and now who are very successful in their life. You can find their experience so that you can get more confident how it sound. And then, do you have any other question? I can arrange another meeting. So this all about the scenario to solve. So this all I'm making to help. I'm not 100% perfect. If you feel that any modification is there, please give it in the comment section, or if it is helping you, please um, give any comment so that it makes me more energy to make this type of recording for you. Thank you very much. Assalamu alaikum.